Have you guys seen that video of that nurse that got held hostage in that patient's room over Thanksgiving? I have some thoughts. Number one, if you're not a nurse, sit down. Sit down. If you've never had a colostomy bag thrown at your head, sit down. If you've never been kicked in the stomach or punched in the face and been told it's just part of the job, sit down. As you can tell by my handle, I'm just another nurse. ER nurse, CCU nurse. And I left the bedside because of this. Because of family members, just like this. Now, I have never worked in long-term care, and I never will, and bless all the nurses that work in long-term care because I could never do that. From what I hear, your ratio is 30 patients to one nurse, maybe two aides. If the aides show up, if they staff them correctly. I just want to put this in a little bit of perspective. If you are a patient family member in these long-term care settings, I know it is frustrating, but if your nurse has 30 patients, that means if she doesn't sit down to pee, to chart, to do anything, that nurse can give 2 minutes of care to every one of her patients every hour. Again, that's if she doesn't go sit down to pee. 2 minutes. I know when I've worked in the ER and the CCU, I would be in a patient's room maybe up to 20 minutes sometime cleaning them up. 20 minutes. Med passes are not quick. And especially with all the new rules and regulations, you literally have to go over every single medication, side effects, any questions, as you should, with the patient. And with long-term care, most of those people are not on one med. They're on like 20. So med passes are not a quick thing. Ergo, it's gonna take longer than 2 minutes to pass meds. So before you take your yearly visit to go visit Pawpaw in the long-term care facility that you ignore all year round, maybe just sit down. You can 100% voice your frustration. And if they are not receiving the proper care, that's completely different. But if you have a nurse, and I could tell that was a good nurse, you might have just killed her entire nursing spirit, and you could have just lost an entire nurse forever out of the field. I hope that nurse sues every single one of those patient family members. I hope she sues them for false imprisonment. You cannot do that. This is exactly why I left the field.